I was at work when I developed some aching to my lower legs, myalgia, and spoke to my manager, and she got me tested straight away.
I've had beautiful friends and family send me flowers and plants to make it feel a bit more homely.
Emily Morris was working as a nurse in the emergency department at Royal Melbourne Hospital. But after testing positive for COVID-19, she's isolating in a government-allocated apartment so she doesn't put her housemate at risk.
95.
I was absolutely devastated. I think that as a healthcare worker, there is a little bit of shame and stigma around being diagnosed as COVID positive. So for me, I've worked mostly in the respiratory emergency department, which means that I wear an N95 mask. Then on top of that, I wear a face shield, hair coverings, as well as a full-length gown.
The 32-year-old has worked directly with COVID-positive patients, but suspects she contracted the virus in the community.
Considering the high quality of the PPE that we have and the procedures that we have in place, I am very certain that this was a community-acquired transmission. We need to look after our healthcare service so that we can look after you. Please wear a mask, wash your hands, socially distance. Do not leave your home unless it is absolutely necessary.
Got some salad, fruit salad. Hopefully I can keep this down today.
I'm putting myself out there to say I'm young, I'm fit, I'm healthy, I was doing the right things and I got coronavirus.
There have been at least 719 COVID cases reported in healthcare workers in Victoria since the beginning of the pandemic.
I think that I'm actually just a bit sad for my city at the moment and sad for my fellow frontliners, and just had that realisation that this doesn't end when I get out of isolation.
So this is one of two places that we spend most of our time. Doesn't seem like much of a walk, but on a bad day, it is an absolute killer.
Contracting coronavirus has been a life-threatening ordeal for Melbourne couples Sam Martin and Sarah Robson.
Just this weakness washes over your body and you just know, I'm not getting enough oxygen right now. I physically can't breathe enough to perfuse my whole body. I got up and basically just collapsed to the floor. Let me try and prop you up on your back.
Both work as midwives for the Royal Women's Hospital, but are confident they had no contact with patients while infectious. Sam suspects he contracted coronavirus earlier this month through community transmission and passed it on to Sarah.
I couldn't take a full breath. I had to take little sips of air when I could to try and catch back up again.
Sam's symptoms were so severe, he was rushed to the emergency department of the Royal Melbourne and admitted to the COVID ward.
It's so scary to know that your lungs aren't working the way that they should.
After 3 days, the 26-year-old was discharged. Just a few days later, he was forced to call an ambulance for Sarah, who was also hospitalised with severe symptoms.
When I have acute exacerbations of the pain, it feels like someone is stabbing my lungs all over, and the rest of the time it just feels like a constant scraping or rubbing like sandpaper.
If people need any motivation to do the right thing, think of the person you love most in this world not being able to breathe properly, struggling to catch their breath, literally lying on the floor because they can't stand up, because they can't breathe properly, because their body is just like, nah, we can't do this.
Where do you want to be, couch or bed? Because wherever you choose, I don't think we should move for the rest of the night.
Couch.
Okay.
Sam and Sarah are now both isolating and monitoring their symptoms at home. Sam is doing better, but Sarah's condition deteriorated again over the weekend. She's never struggled with respiratory problems before.
Let's just take some Ventolin, sorry.
So can you sing a song to us?
I don't know if Mummy's lungs can sing a song tonight.
The 30-year-old midwife is also a mum to 2 young boys.
I love you, X infinity.
I don't know when I'm going to see them again. I don't know when I'm going to be able to do what I love most in the world, which is be a midwife again.
So part of keeping Sarah out of hospital is obviously keeping a really close eye on her.
The young healthcare workers want others to know the virus can ravage otherwise fit and healthy people.
I would really appreciate the community to not sort of get fatigued by those messages that we're hearing daily. You are the front line now as the community. We need to protect healthcare workers, protect people like Sam and I and all of the incredible staff who were able to care for both of us in our periods of hospitalisation.
This can make you really, really, really sick. This can kill you. It doesn't matter how old you are, it doesn't matter how fit you are. You may be one of those lucky people who is asymptomatic, but if you're doing the wrong thing and you pass it on to someone else, it could kill them.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.